Surgical management of an atrial septal defect, ASD, is typically indicated when the defect is large, symptomatic, or has led to complications such as right heart enlargement, arrhythmias, or pulmonary hypertension. The goal of surgery is to close the defect, thereby preventing the left to right shunt of blood, which can cause long-term damage to the heart and lungs. Symptomatic patients experience symptoms such as shortness of breath, fatigue, or palpitations due to ASD. Right heart enlargement is evidenced by right atrial and ventricular enlargement on imaging, indicating significant shunting and volume overload. Surgery is considered if the patient has developed pulmonary hypertension secondary to the ASD, provided the pulmonary vascular resistance is not too high. Some patients with ASD may have frequent lung infections due to increased blood flow to the lungs. Patients who have had a stroke or other embolic events due to blood clots passing from the right to the left atrium through the ASD may also require surgery. For surgical techniques, primary surgical closure involves direct suturing of the edges of the ASD to close the defect and is typically used for small to moderate-sized defects. This method is usually preferred for small defects or secundum ASDs that are centrally located and easily accessible. Patch closure involves sewing a synthetic patch or a pericardial patch over the defect to close it, and this technique is used for larger ASDs or for defects that are not suitable for direct suturing. Minimally invasive surgery involves smaller incisions and the use of specialized instruments, reducing recovery time and minimizing scarring. This approach is suitable for certain patients with secundum ASDs, depending on the size and location of the defect, as well as the surgeon's expertise. Robotic-assisted surgery is similar to minimally invasive surgery but performed with the assistance of robotic technology, allowing for greater precision and is used in select cases where a highly precise operation is beneficial. Postoperative care includes monitoring patients in the intensive care unit for any signs of complications, such as arrhythmias, bleeding, or infection, with vital signs, oxygen levels, and cardiac output closely monitored. Postoperative pain is managed with analgesics, which is crucial for effective breathing and mobility during recovery. The typical hospital stay after ASD surgery ranges from a few days to a week, depending on the complexity of the procedure and the patient's overall health, with full recovery usually taking several weeks to a few months. Regular follow-up appointments are necessary to monitor heart function and ensure that the defect remains closed, with echocardiograms typically performed during these visits. Complications may include a small residual shunt that may require further intervention if symptomatic, postoperative arrhythmias such as atrial fibrillation that may require treatment with medications or ablation procedures, inflammation of the pericardium leading to symptoms like chest pain and fever, and the risk of infection that may require antibiotic treatment. The long-term prognosis after surgical closure of an ASD is generally excellent, especially if the defect is closed before significant heart damage or pulmonary hypertension develops. Most patients can return to normal activities after a few months, although those with more complex conditions or complications may need longer recovery times. Some patients may require lifelong monitoring for late complications, such as arrhythmias or residual defects. As an alternative to surgery, percutaneous device closure can be an option for suitable candidates, especially those with secundum ASDs. This minimally invasive procedure is performed in a cardiac catheterization lab and typically requires a shorter recovery time than surgery. It is ideal for patients with centrally located secundum ASDs and adequate rims of tissue surrounding the defect to anchor the device, offering reduced recovery time, less invasiveness, and fewer complications compared to open-heart surgery. Surgical management is a definitive treatment for atrial septal defects and is often curative, especially when performed before significant complications arise. The choice between surgical closure and percutaneous device closure depends on the size and type of the defect, patient age, and overall health.